Introduce myself. My name is Aleksandr Fedulov. I'm the head of the Department of Neurology and Neurosurgery at the Belarusian State Medical University. And today I wanted to talk with you about such issue as traumatic brain injuries. But first of all, I would like to get you a sheet of paper in order to write down maybe one or two questions in which you would like to have an answer at the end of my question. Please write down. Oh, sorry. Please write down your one or two questions, please. No more. No more. What are the learning objectives of this presentation? First of all, we will begin from the definition of traumatic brain injury, then we follow to overview of TBA from the position of some points of statistics. According to this issue, review of types of traumatic brain injuries, discuss long-term issues, acute care management, and post-acute care constitutions of patients with traumatic brain injuries. Of course, we must begin from the definition of this issue. What is the traumatic brain injuries? According to the classical definition, traumatic brain injury is non-degenerative, non-congenital insult to the brain from an external mechanical force, possibly leading to permanent or temporary impairments of cognitive, physical and psychosocial functions with an associated diminished or altered state of consciousness. You know that traumatic brain injuries nowadays is #1 killer in all over the world, and unfortunately 25% of all trauma, of this kind of trauma, associated with very high level of mortality, 25% of all trauma. 50% of all deaths are the deaths from the motor vehicle accident, and more than 2,000 people in the world live with a disability caused by these injuries. Traumatic brain injury can interfere with such issue as thinking, remembering, seeing, controlling movements, and some other. This picture illustrates you the most important reason of this issue, not only in Belarus but all over the world, and you may see such a huge picture of some patients in any regions of our world. There are some demographic and age preferences according to this issue in different countries. Traumatic brain injury affects all levels of society, affects all ages, and the majority from 75 to 80% recover quickly, and 20% of all traumatic brain injuries are mild traumatic brain injuries. From 10 to 25 patients or survivors have long-term deficit, unfortunately, and nearly 2% of Americans living with traumatic brain injuries related disabilities. Some of patients had such problem as emotional distress and cognitive issues after traumatic brain injuries. What are the risk groups of traumatic brain injuries? As you see, males are more likely to incur traumatic brain injuries compared to females. Highest rate of injury is between 15 to 25 years old. Also, at higher risk group are children, less than 5 years old, and elderly, more than 75 years old. Trauma centers are the epicenter of traumatic brain injuries. Hospitalization increasing 10% per year. Early identification improves outcomes, no doubt. Appropriate inpatient management important. Post-hospital rehabilitation, improves outcomes. Collaborative efforts through multidisciplinary teams is very important. Let's try to describe some pathophysiological background of traumatic brain injuries, and we begin from such basic term as intracranial physiology, for example. The other issue will be recognize the importance of limiting secondary brain injuries. The third one, perform a focused neurological examination, and the final, stabilize and arrange for definitive care. Let's have a look, or I would like to remember you some anatomical and physiological background of cranial and basic themes of neuroanatomy. As you know, we have scalp, skull, meninges, dura mater, arachnoid, pia mater, brain tissue, cerebrospinal fluid, and blood. What are the key questions which we may keep in our mind when we recognize this issue? What are the unique features of brain anatomy and physiology, and how do they affect patterns on brain injury? What is a focused neurological examination, and what is an optimal management of the brain injured patient? How do I diagnose brain death? Thank you for your attention. Let's have a look to your question for me as a teacher.
I can read it.
Okay, yes. I would like, maybe we will continue a little bit, and I'll try to answer
maybe
for
after video.
After video, okay. Why females are in risk group with traumatic brain injuries?